Hello, everyone, and welcome to another segment of the East Brunswick Advisory Health Council's Wellness Spotlight. According to an article that appeared online in Yale Medicine last week, even as people began to feel some hope, or at least cautious optimism, early this summer that the pandemic could recede to the background, there was still the threat that new mutations of COVID-19 virus could bring it back, and it even might be stronger. A major worry right now is Delta, a highly contagious SARS-CoV-2 virus strain, which was first identified in India in December. It swept rapidly through that country and Great Britain before reaching the U.S., where it is now the predominant variant. The Centers for Disease Control and Prevention describe Delta as more transmissible than the common cold and influenza, as well as the viruses that cause smallpox, MERS, SARS, and Ebola, and called it as contagious as chickenpox in an internal document, a copy of which was obtained and reported on in the New York Times. The highest spread of cases and severe outcomes is happening in places with low vaccination rates. Virtually all hospitalizations and deaths have been among the unvaccinated, the CDC says. But the CDC released data in July that showed vaccinated people can also transmit Delta, which officials did not believe to be the case with other variants, and which led the agency to make a prompt revision to its masking guidelines. Today on Wellness Spotlight, we have a panel of distinguished experts to update us on the latest information to keep us safe. Dr. Richard Snepar is an infectious disease specialist in East Brunswick, New Jersey, and is affiliated with multiple hospitals in the area, including St. Peter's University Hospital, Central State Medical Center, and Robert Wood Johnson University Hospital. He received his medical degree from Weill Cornell Medical College of Cornell University and has been in practice for more than 40 years. John Dowd, Division Head of Public Health Preparedness and Health Education, has been employed by the Middlesex County Department of Public Safety and Health Office of Health Services for 26 years. He currently supervises the daily activities of the division and is responsible for managing emergency preparedness and health education grants and planning, implementing, and evaluating community outreach programs for residents and public health partners. During his tenure with the department, he has served in the roles of health educator risk communicator, health education and coalition programs coordinator, and as a registered environmental health specialist. Completing our panel of experts is Dr. Brad Cohen, Mayor of East Brunswick. An OBGYN for the past 30 years, Dr. Cohen's practice is located in East Brunswick. He received his medical degree from Rutgers, New Jersey Medical School, followed by an MBA from Rutgers Business School. Previously, on the East Brunswick Board of Education from 2010 to 2016, Dr. Cohen has served as the mayor of East Brunswick for the past 5 years. He was elected on his promise to provide East Brunswick residents effective financial policy with more community services, programs, and opportunities. His administration's response to the COVID-19 pandemic resulted in one of the lowest infection rates in the state of New Jersey for East Brunswick residents and the township's employees. So now I'm going to bring our panel forward. I'm going to put my mask on because that's what's safe for us to do when we're around other people. And we're going to give you the best information available currently on COVID-19 and the Delta variant. Mayor Cohen, Dr. Snepar, John Dowd, welcome to the Wellness Spotlight. Thank you, gentlemen, for making the time to be with us today.
Thank you for having me.
Welcome.
Dr. Snepar, I'd like to speak with you first. How is the Delta variant different than the Alpha variant?
Okay, so we're talking about the coronavirus, and the coronavirus, like many viruses, mutate as they're in the population. They change their composition. You're familiar with that from the flu vaccine, which changes its type. So we have the same thing with the coronavirus. Now, you hear about all these different names. You hear about alpha, beta, gamma, delta, and earlier on in the pandemic, you heard about numbers. Well, the virus types were initially called numbers. Now they've been given Greek letters. So the Delta virus is the virus that the strain of the virus that has taken off in India. It was pretty much very virulent virus in that population, and now it's the predominant virus in the United States. The alpha virus was, the alpha variant was the variant that everybody recognized was the England variant, okay, or the UK variant that we all heard about, earlier in the pandemic. The initial virus, the coronavirus that we were dealt with early in the pandemic, that's just called the wild type virus. It doesn't have a Greek letter affixed to it. So everything with a Greek letter is a variant of what we call the wild type virus. And the Delta virus, as we'll discuss further, is a very aggressive variant of coronavirus.
What does it do to the body?
Well, it is felt to cause more aggressive disease. So, the coronavirus causes respiratory tract disease, and by and large progresses to pneumonia or involvement of the lungs. And the Delta virus does that quicker, does that with a higher propensity. It's as well as being more contagious and more transmissible, it causes significant illness quicker.
This question's for anyone here who would like to answer it. Does anyone know if there have been any confirmed cases of Delta virus in East Brunswick?
Well, to look at the different variants within the state,
yes,
you would go to this, the state dashboard, and then they'll have the predominant variants that are within the state. So that's one way you could see it statewide.
We're over 80% effect of viruses from the Delta variant as reported by the state. So I think for the most part, we're going to have to assume, just based on the numbers alone, that if somebody's coming down with COVID right now, it's more likely than not to be the Delta variant.
How are the residents of East Brunswick doing with all of this compared to other areas?
Well, fortunately, we've done fairly well throughout the pandemic from the beginning. One of the things we did right from the very start was to close down some businesses and some activities that even the governor hadn't done yet. He will not have done that until about 2 weeks after we did. So I have to believe that that alone helped reduce spread of infection here in East Brunswick. As we were watching our numbers throughout the entire pandemic, we always seemed to track at a lower level of infection rate compared to a lot of other townships in the county. And if you take into account the fact that we have long-term care facilities located here in East Brunswick, which we had no control over who was admitted to those, if you look at us among other towns that had long-term care facilities, I think we were one of the lowest. And part of that is people followed a lot of the restrictions that were put in place at the time. Nobody was happy about it, but people stayed home, people distanced, people wore masks, people washed. And we were able, fortunately, to move to a remote form of education early on. So I think part of that all contributed. And then on the flip side, once the vaccines became available, we were rapid, adapters. We got a large percentage of our population vaccinated. Last time I checked, we were somewhere around 78% of the township is already vaccinated. And I think that we made a huge effort to work early on once they became available to get those people that were greatest at risk vaccinated. So the township worked to make sure that our seniors got vaccines. We made sure that those that were immunocompromised got in. We were rapid to try to co-work with the county to make sure we had a administration site here. So I think that all those things added up allowed us to track our own curve a little bit lower than the average in terms of infections and higher than the average in terms of vaccinations.
Dr. Snepar, who's most at risk with COVID Delta?
Well, the populations most at risk are the elderly and immunocompromised. Patients that have underlying immunosuppressive conditions may not make as adequate a response to the vaccine. They're certainly at higher risk of getting consequences of the coronavirus or the Delta virus themselves. People certainly now we're starting to see the younger populations at risk. We're starting to see in the pediatric community. The risk is broad. But at both extremes of life, the risk is under 1 year of age and over 65 are the worst.
The pediatric population mainly because they haven't had the years yet to develop healthier immune systems by being exposed to other viruses and bacterial infection?
Well, it may be that you could say that, but children under 1 are just very vulnerable to many infectious diseases, and this is a significant respiratory hit for an infant.
What do you feel is the best protection against Delta?
Clearly, it's not a guarantee if you're vaccinated that you can't get breakthrough infections, which is one of the reasons that I believe the governor and the health department reinstituted the idea of masking and distancing and washing, because 100 years ago in the Spanish flu, that's what got us through that. So it's those three things in combination have been supported by even the data today, the best way of mitigating against transmission of infections. So I think that is the reason we're back to doing that right now, and that's probably the reason that the governor made that a requirement of going back to school.
So I mean, continuing to get vaccinated, continuing to wear your mask, but also at the same time remembering good health practices, staying healthy, keeping your immune system healthy. I know you're big on that. Also, staying home if you feel sick would help, stop the spread of illness in the community.
A major protector against Delta virus is the vaccine, and you read about breakthrough infections. We're having breakthrough infections. There's a significant amount of breakthrough infections, but those patients they're not getting hospitalized. They're getting mild disease. They're not getting severe disease. So the fact that that's really what you need. The patients that we're seeing in the hospital, and you read about that the hospital numbers are going up throughout the nation as well as in New Jersey. But those patients are by and large non-vaccinated individuals. So the vaccine is critical in terms of preventing or keeping people healthy.
So if I understand you correctly, are you saying that the vaccine doesn't prevent you from getting Delta, it really mitigates the severity of the infection by helping, mitigate the effects of it?
Well, no. The vaccine will prevent many from getting Delta. It doesn't prevent all from getting Delta or the other types of coronavirus. But if you wind up getting it, among the small amount that do wind up getting it, that'll be a much milder disease than the people who wind up getting the disease that are unvaccinated.
So what we're really talking about is a combination of having the healthiest immune system possible in combination with getting vaccinated.
Right, and then the preventive measures that were just discussed.
Mayor Cohen, did you want to add something?
Yeah, I just think that people forget that even from the very beginning, none of these companies promised you that you wouldn't get the virus. They never said that. Some were 95%, some were 96%. J&J was in the 70s. They never or 60s, I think. It never promised you wouldn't get infection. We were fortunate with the Alpha variant and the wild variant that for the most part, they found that people that were vaccinated typically did not get infected. That changed with the Delta variant. It seems to be that that's much more virulent, and it has a propensity to spread faster, and it has attacked people that have been vaccinated. But like the doctor said, by and large, those people that are getting sick ending up in the hospital are almost always almost exclusively the group of people that were unvaccinated, and that's what the vaccine companies had always promised it would do. It would prevent hospitalization, use of ventilators, and death.
For example, can I just add to that? Just an example was, you read about the outbreak in Provincetown, Rhode Island, where about 450 people came down with coronavirus, and it was a Delta virus. And of the people, 350 of those 400 were vaccinees, but none of them were hospitalized. So there were no deaths. So they did well with the illness.
Has the composition of the vaccines changed since the manufacturers were granted emergency use authorization? Has the recipe for making the vaccine changed, or has it been the same throughout?
No, it's the same vaccine. So you have the mRNA vaccines, which is the Pfizer vaccine and the Moderna vaccine, and then you have the vector vaccines, which are the only one that's in the United States is the J&J vaccine, the Janssen vaccine, which is a protein of the coronavirus that's hooked onto an adenovirus.
So if somebody hasn't been vaccinated yet and they're considering it, which vaccine do you think would be best? Is there one that's better than another, that has higher efficacy rates in preventing disease?
It's hard to compare them because the studies for the mRNA vaccines were done earlier in the pandemic than the Janssen vaccine. The Janssen vaccine was studied later. So the virus types that they were being pitted up against were different. So it's hard to compare the Janssen and the mRNA vaccines. And I think the feeling is that you can take whatever vaccine you can get.
Can you mix and match the Pfizer and Moderna vaccines, between the first and second shot? Is that okay, or should you stick with wherever you started?
The recommendation is to stick with what you started.
Yeah. To play devil's advocate, what would you say to somebody who says, well, you know what, if I could still get an infection after having been vaccinated, then what's the point of me getting a third vaccine? Maybe it doesn't work that well. What would you say to them?
Well, I think that there's a lot of people, and studies coming out of Israel are showing that the biggest breakthrough infections are amongst those that are over 60, which leads you to believe that did they not mount the same antibody response compared to people that are younger? Did they have a much greater propensity to being immunocompromised than people that are younger? So there's probably many reasons in that they are at more risk, which leads you not to the question of whether or not they should be vaccinated, but more to the question of whether or not there should be a booster and when that booster should be given.
So as long as you bring that up, when would you recommend a third shot or a booster shot be administered?
The recommendation currently, which it's fresh, is that a third dose of mRNA vaccine should be given to patients with immunocompromising conditions, and those conditions have been laid out by the CDC. And you really need to talk to your physician if you are immunocompromised to identify whether you're in that group. It's not a blanket recommendation for a third shot for all. Yeah. That has not come out yet.
Now, that's for the Pfizer or Moderna mRNA vaccines.
Right.
What about people who have had the J&J vaccine, that one single shot? Should they get a second one, or are they finished?
It's not recommended at this time. So the only one that just came out was Saturday, August 14th, and that was the FDA, the Food and Drug Administration, and the Centers for Disease Control and Prevention. They authorized the third dose for Pfizer and Moderna for moderately or severely compromised immune system after the initial 2 doses. So this includes patients in active cancer treatment, organ or stem transplant recipients, and then a full list is available on the CDC website.
Thank you, John.
Yeah, and as John said, there's no recommendation yet for the
Right, beyond that.
Beyond that for the Janssen vaccines, and the feeling is that the reason is they just don't have the data yet. That vaccine was brought out in March, so there's not been enough time to really, and there's not as many patients because all of those immunocompromised patients, they were vaccinated early with the mRNA vaccines, so they don't have that. There's not enough population yet to look at.
There is talk, I think, at the CDC about making a recommendation soon about vaccination boosters. Talk about 8 months from the being fully vaccinated. That's the talk. It hasn't been determined. They're still looking at the studies, and so there has been no official statement on that. Again, as we referred to in Israel, which is a country that's a little bit more vaccination rates a little higher than ours, they're recommending it for people above 60. So does that mean we're going to follow that? Does that mean we're going to chart our own course? But it's going to be based entirely like it's always been, which is on the data and on the information and studies that they're getting. And the CDC has a very systematic approach to how they do that, and the FDA, and they're not going to change that. They're going to do the right thing.
Is Israel using the same vaccines that we are, or do they have their own?
I think they're using Moderna and Pfizer for the most part.
Yes.
What are some of the most common reactions that people experience?
So the common reactions are fatigue, headache, fever from 24 to 48 hours. A sore arm is a big one.
Yeah.
So those are pretty much the common side effects. In terms of long-standing side effects, there's not many. I mean, there have been some associated clotting events that have been written about with the
J&J.
Yes, with that vaccine. There's been a small group of myocarditis that has been seen with mRNA vaccines in young men.
Young men.
Right. So again, it's a small amount, but by and large, and these side effects generally occur early, not late.
With that many people that have been vaccinated already in this country, if there was something that was really, really horrible that was going to happen from the vaccine with that many people vaccinated, I think we would have all heard about it by now. I think there's pounds and pounds and pounds of data that the FDA is going through in order to try to come up with this, moving us from a authorization as it stands right now to a formal approval of the virus, a vaccine. But just statistically, we live in a country where information is so easy to obtain. If something was happening, it would be out there and on your cell phone in a microsecond. If there was that many bad things happening from this vaccine and that many people are vaccinated, we'd have all heard about it by now.
Well, that would be over the short run, but many people are saying, well, we don't know the long-term effects. So when is it fair to say, if we were going to see long-term effects, when we would see them by? How long?
Well, by and large, with vaccines, long-term effects are not seen. Usually the effects are short-term effects. And I think within 6 months to a year, you would be seeing them.
Within 6 months to a year, and
Yeah.
6
And they've
months
been
to a
out.
year.
Well, even you have the studies from last summer, that led to the EUA on the mRNA vaccines.
And that would support exactly what the mayor's been saying.
Yes.
We would have known anything that was happening, we would know by now. Can you talk a little bit about the new masking guidelines? Consumers Reports just talked about new masking guidelines, updated masking guidelines for Delta. Can any of you share some of those new masking guidelines and what's recommended?
The recommendations right now is like if you're in an indoor and in our larger crowded areas, it'd be recommended to wear your mask.
Yeah, I think most of the studies have shown that if you're in normal circumstances in an indoor setting in a area right now like New Jersey, which is considered to be a substantially high-risk state based on the transmission rate, that indoor masking should be utilized. Most people who have looked at the differences in masks for that type of purpose have not really found that it mattered that much which mask you used. Where it matters is if you're actually in the hospital and you're taking care of patients with COVID. Then they want you wearing N95 masks, respirators. There it's a lot different because your risk of getting the infection, your exposure is so much different than in the general population. But most studies haven't really shown that it matters that much, but that using a mask compared to in combination with keeping social distancing and hand washing reduces the rate of transmission, and it almost didn't matter which mask you wore.
So there's a small percentage of the population in this area that's yet to be vaccinated. What do you think some of the most common reasons are? And what information can you share to help support them making a more informed decision?
Well, basically, it's always you would consult with your physician in regards to making the best decision for a vaccine. We at the county we provide all 3 vaccines that are available, and you can look up our clinics and stuff on the website to make an appointment at Middlesex County nj.gov/COVID-19, and also besides that too, if you don't know if you got the disease or not, if you don't have the vaccine, or even if you did get the vaccine, you can always go for testing too as well to maybe limit the spread of the illness in the community.
I think there's different populations of people that have different reasons for what they do, so it's hard to put or paint everybody with one paintbrush. There are people who are here from other countries who may not be citizens and are afraid that if they come forward that they're going to be deported. I think the county and the state has done a great job trying to arrange vaccinations for them, no questions asked, no information about identification, so that it puts them at ease from worrying and having that fear, but that's a legitimate fear. I think there's the African American community that has a history of where American scientists have used them as for testing, and that was not fair, and that's just generational. It's going to be hard to overcome that, but I think with education and outreach, I think you can do that. I think there's some people who are making this, probably more than some, a political issue, which it never should have been, and are making a stance based on distorted political notion that this virus is political. It's not, nor is the vaccine. And I think there's some people that are just downright fearful for women who are pregnant, who, even though the American College of OBGYN has absolutely supported vaccination among pregnancies in immunocompromised states, so they're actually already at greater risk for infection while pregnant. It makes sense to vaccinate, but the idea of putting something foreign in your body that hasn't been tested, that's a hurdle that in many instances we just have to overcome. Bottom line on all of it, I think, is education and outreach, and to try to guilt people into doing it has already been proven to be a mechanism that does not work.
Mayor Cohen, what specific steps have you initiated within your administration in addition to those many steps that you've already taken? Are there any additional things that you're doing with respect to Delta, with the county?
Well, we were very fortunate as the numbers in the community were starting to drop and our vaccination rates were so high. We were really thrilled to be able to open up the building and start having people come in, telling people they didn't need to wear masks any longer. And it was if we were really driving at 100 miles an hour and the vaccine was in the rear view mirror. But with Delta, we recognized that that's not the case any longer. And so we had to reinstitute a mask requirement indoors. We have to put the distance requirement back in place, and we obviously have always had the hand stations for washing. That never went away. So that really had to be reimposed, and it's tough for people who were just used to being able to get behind them and felt that we don't need to do this any longer, and they see that we're a town that's 77% vaccinated. Why do we have to do it? The senior center, we have residents that were the first group that was shut down, right? They were the most at-risk people. We shut them down first. And now they are back into the center, and I still have a handful that just are so unhappy that we're requiring masks. Well, I'm sorry, I don't want anybody getting sick. And so those are the things that we really have to put in place, and we're enforcing. Obviously, many are aware that the governor was here about a week and a half ago and announced that he's doing a mask mandate for people in schools. It was a blessing for the teachers and administrators who were trying to figure out among the 600 some odd different districts what they were going to do on that issue. This has now made it easy. Everybody's doing the same thing, and takes that off of the table. There were protesters. You know, that's people have the right to protest, but they don't have the right to the facts. Facts are the facts. And reality is that at this point, that is the most effective way of reducing spread of infection. And honestly, the kids don't mind. I think the parents are making a much bigger deal of this than the kids are. They've had masks used for a while now. They get used to it. I've seen signs depriving my kid of oxygen. I don't know. I've spent 30 years in the OR. I've yet to see a doctor or nurse get carted out of the OR because we were running out of oxygen. Yeah. So it's just silliness.
Yeah. And then we're going to continue to take a proactive approach in safeguarding the health and safety of the community. You know, we're continuing our collaboration with the local municipalities, our other county officials. We're going to continue our testing. So we have testing right now, currently once a week in our Piscataway site. We've done drive-through testing. We've done drive-up testing. So we have various modalities. We're going to continue to provide the vaccination. We're going to work with the New Jersey Department of Health. We're going to, try and find pockets, where people don't have an uptake of the vaccine. We're also going to continue to assign we have our Medical Reserve Corps volunteers. Dr. Cohen is one of them. I'd like to take this moment to thank him for providing his time and service and giving out vaccines at our various sites. Are right here in East Brunswick. And we have a great team at the county that has all the logistics that have to come with that. You saw what they bring in to to have one of these clinics. Mm-hmm. So, and then the rest of our staff, providing, day in and day out, testing, vaccination, and also continuing to collaborate with the schools, universities, our hospitals, long-term care facilities, and to continue with the surveillance and also with the community outreach, what we're doing here today.
And it's important for people to know that there is no charge to be vaccinated. Is that correct?
It's free.
It's free. Do you vaccinate people in East Brunswick? Does the county have a vaccination site in East Brunswick? Are they planning on having one in the near future?
We've had sites here in East Brunswick. We kind of rotate around through the county, so.
They've been using it at the height, at the Community Arts Center, which we're more than happy to let the county use. Mm-hmm. And now that the numbers have dropped, I think they've had to retract some of their sites, so that's not used as frequently as it had been at the height of the when people were first all lining up to get vaccines. Fortunately, now it's so easy to get.
Yeah, because now you can get at local pharmacies and a lot of other places now.
Right.
If people want to find out more about where they can go, where do they go, John, to learn more about where the next location is to be vaccinated?
Well, they can go on the website, which I said before, so they could kind of go on to the Middlesex County NJ.gov/COVID-19, and they could also call our call center at 732-745-3100, extend and then press 1, and then staff can help. And also, what I didn't mention before too, we also provide vaccine for homebound individuals as well. So you would call that number, the 732-745-3100, press 1 to schedule an appointment for homebound as well.
Now, if you want to be vaccinated, does somebody need to make an appointment to go to your location, or can they take walk-ins?
You can go online and make an appointment, but you can also just go as well.
I think I might add that one of the things that I'd spoken to to Judy Persichelli, who's the director, commissioner of the public health. I think one of the things that they're working on trying to do is to make it easy to get the vaccines to the physicians. Because ultimately, at the end of the day, I think what people really need to hear from is their doctor. And when they have that conversation and when they get that interchange of ideas, that's the best time and likelihood that somebody is going to consent and agree to getting it done. And if you could then be able to just give the shot at that time instead of now tell them to go to a different place and pick it up, I think we would actually be able to see vaccination rates pick up a little bit more.
Yeah.
I have a practice here in East Brunswick, and the patients are always asking, can I just get the shot here? We're just waiting.
Yeah.
So they
just
can
give
get
it to
it from
me
you
now.
if they want to.
Oh, yeah.
Okay.
then-
Once that can be done.
Yeah, we have our weekly schedule is on that website. You can go there as well, and then just book the vaccine appointment directly. So it's better to usually book book the appointment.
Mayor Cohen, last year you developed a program that concerned students in East Brunswick schools. You spearheaded it between the county and the school system and the township that had to do with testing. Is that program still in effect?
Yeah, that was a program that was based on information that we got out of the, believe it or not, Air Force Academy, and what they had studied in terms of the appropriate testing schedules within their own academy in order to try to reduce the rate of infection, which of course is a closed community there, which is a little bit harder to extrapolate how that would work in a school where people are coming and going. And we had made an arrangement with the county to do some regular testing in schools, but that was just before the end of the year when the rates started to go up, and then the schools went back into basically a virtual modality of teaching, and so it ended up not happening. But at this point, we're fortunate because there's so many more places that you could get testing done today compared to what was done then. And so the township, for instance, has a great relationship with the county. We're constantly sending people to county sites. We have a good relationship with Brunswick Urgent Care Center. So we have so many different places that testing's available, and a lot of people could self-test. So there's a lot more availability today than there was when that was put in place. So I know the schools are working with an individual firm for testing there, and the township works with either the county or Brunswick Urgent Care Center, and we've been able to have fast turnaround times without needing to go to a program. I think it's back to necessity is the mother of invention, right? So as the need goes up, more and more people come into the market, and so it's not as difficult as it was earlier on to find testing.
How will school-age children be protected when they go back to school in the fall? They'll be attending classes together, and these kids under 12 are not being vaccinated. It's not recommended that they be vaccinated. So what is going on to protect them? I'm sure a lot of parents are wondering.
Well, that I think was the whole point behind the governor making
The masking
the
recommendations?
mask mandate, so that the combination, as we keep saying over and over again, it's not one thing. It's the masking, distance, and washing that helps reduce the spread of infection, and that is something that's going to be enforced to try to reduce the risk among those that are vaccinated as well as those that are not. And clearly, as you just said, all those under 12 are not vaccinated because it's not approved in that age group yet. And there's going to be people even among the kids between 12 and 18. Right now, I think in Jersey, it's about 30% people vaccinated. We need to get that number higher. But in the meantime, the same techniques are going to be employed in the school, and the hope is to be able to keep them in person. We've lost a lot by these kids not being able to be in person, and so if it means that we need to do masking and distancing in order to keep them in school, I think it's a small price to pay.
And these studies that showed reduced transmission among children in school, the ones that were successful paid attention to these ameliorating measures, wearing masks, meticulous hand washing, and distancing.
Yeah, remember our good hygiene practices,
Yep.
washing your hands, covering the coughs and sneezes. I know it's hard to get the kids to, to put their arm up and use a tissue,
Right.
so.
100 years ago, right? None of us were here, unless we look really good for our age. But that Spanish flu, they didn't have vaccines. They didn't have monoclonal antibodies. They didn't have Remdezvir. They didn't have any of the things that we have today, and even antibiotics to any extent. What did they use? They used hand washing and masks and social distancing, and it did eventually, dissipate. There was a couple of outbreaks, and there were variants, but it did go away, and so it just takes us back to what we've known for a very long time. Still works.
And then touching your face with unwashed hands, you're kind of putting the germs right directly, into your eye. So, and then maintaining our social distance, all helps.
And the schools are going to be realistic. The governor made it very clear that if it's lunchtime, they're going to try to space people out. You don't need to wear a mask for that. If you're outdoors, you don't need to wear a mask then. If it's brutally hot, you're not going to wear a mask then. And most likely, if it's that hot, they're probably going to let you go home. So there's enough, ability for people to be realistic in mask use and not be cruel. But on a regular basis, I don't think wearing the mask is going to be such a big imposition.
Is Remdezvir effective against the COVID Delta variant?
Remdezvir has been useful against coronavirus throughout the pandemic. Has it specifically been tested against the Delta variant? I don't think that study's been done, but it continues to be a useful modality. But I do have to say that the patients, pretty much the unvaccinated patient that comes down with Delta virus will come in sicker. They just come in with more lung involvement, more oxygen, more need of high levels of oxygen much quicker. And they need Remdezvir, and they need a bunch of other interventions. And as we were talking about earlier, the vaccinated patient, you just don't see that level of severe disease. If they have to be hospitalized, they get out quicker. I'm seeing a bunch. I just came from the hospital, seeing a bunch of patients with COVID on a regular basis, and you can see a difference.
Mm-hmm. Mm-hmm. We have a wonderful emergency management coordinator, John Kosick, who had appeared on a previous Wellness Spotlight on COVID-19, and he had recommended that we get our information from reliable sources, that there was a lot of disinformation that was out there. Who do you feel, or where do you feel the most reliable sources of information are for our viewers?
Definitely the Centers for Disease Control and Prevention, also our State Health Department, New Jersey Department of Health. And here on a local level, we have various resources that people could look on the middlesexcountynj.gov/COVID-19 as well.
Yeah, and I use all those sites, and I also like to use the Infectious Disease Society of America site.
Mm-hmm.
I mean, I stick to the FDA, the CDC, and the State Department. Their function is to look at all these studies that are out there and to be able to sift through them with professionals that really know how to evaluate a study and be able to make conclusions and that are valid and evidence-based in their approach. That's what they're trained to do, and I rely on them. I'm not an expert in reading studies. Well, I think I have a pretty good idea on how to read one and interpret one, but not to the degree that they do. So we, as in the healthcare industry, and depend upon them. Studies can be made to show anything. So just because something's showing up on social media, which is absolutely the wrong place to get your information from, does not mean that it's a valid study. Just because it's from Harvard doesn't mean it's a valid study. So we rely on professionals to look at all those studies, and these are the organizations that we're talking about that have the capacity and the expertise to do that, and that's the information we're going to work with.
And for our viewers that would like additional information or assistance in being able to get the information and the answers they're looking for, we also have a wonderful library that has experts here on helping to get the information that people need, yes, not only on COVID-19, but also there's a lot of information here on how to stay healthier. So we would love to encourage people to come in and use this wonderful resource to be able to learn more. in addition to going online. If you need some additional help, come here.
And if people don't have access to go online, they can always call our call center as well.
What's the phone number at the call center, John?
732-745-3100 and press 1.
Thank you. In about the minute or so we have remaining, I'd like to go to each of you for some closing remarks and recommendations for our viewers. Let's start with Mayor Cohen.
I think that the one thing that we've learned through all of this is that the ground that we're standing on is constantly moving. And so what you may have heard today could change tomorrow. That is science. Science is sometimes dirty and it's not exact, and we're constantly retesting and doing models over and over again, and it's subject to new information, and we have to adapt. And so when somebody reads something that's a couple of months old already, I think we just have to understand and get used to the fact that we're living through a pandemic, and the information that's being provided to you is what it is at the moment, and it's subject to change. It doesn't mean anybody's that it's a conspiracy. It doesn't mean that people are trying to get you. It just simply means that as scientists, we get new information and we have to adapt. That's the process.
Dr. Snepar?
A basic principle is you don't want to get a disease. And I think you do not want to get coronavirus, and you want to use all modalities to avoid getting coronavirus that you can. And you just don't want to roll those dice. And the availability to prevent this illness, to prevent severe disease is out there. Get a vaccine, use measures to reduce transmission, and you'll protect yourself against the severity of this virus, which is a very mean foreign protein.
Yeah.
Thank you. John?
The overall is trying to prevent the disease within our community. We've been talking about getting your COVID-19 vaccine. Even now, more currently coming up, it's going to be September, so flu season, so your flu vaccine will be out. Continue to wear a mask, trying to avoid the close contact with people who are sick. Stay home if you're sick. And if you think you have COVID-19, get tested. Maintain your social distance. Washing your hands, keep them to wash hands from your face. Cover your coughs and sneezes. And to echo what the mayor said, just be aware that the coronavirus pandemic is a dynamic, changing situation. And information and resources will continue to evolve. And we're dedicated here, today, and to inform the public the best steps that they can take to protect themselves and their families in the community.
I also think that it's also important for us to focus on wellness too, because one of the overwhelming themes is that healthier people tend to do better than people that are unhealthier. So it all goes back to the basics. Eat right, eat a diet that's not inflammatory, watch processed sugars, be careful of things that produce inflammation within the body, and you can go online and there's a wealth of information about things that are better for you and things that you should avoid, like sugar and processed sugars and things like that. Get your exercise, get your rest. It's important to let the body rejuvenate itself. And think good thoughts, because the mind and body are connected, and you can't have a healthy body if your mind is polluting it with unhealthy thoughts. And you can't think healthy thoughts if your body is sick and diseased compared to a person who's healthier. And I think that it's also important to be checked chiropractically, because interferences in the energy that flows between the brain and the body interfere with the body's capacity to self-heal and function at its peak performance levels. So anything we can do to remove those interferences and enable you to get the most out of the foods you eat, the rest you get, the exercise that you perform, all of the things that build a high quality of life are going to improve your capacity to be able to tolerate whatever physical, chemical, or emotional stresses that we're subjected to, and give us the best opportunity to be able to utilize the vaccines that we get and the other activities that we will be performing to be able to stay healthy and resist disease. So on behalf of the East Brunswick Advisory Health Council, I would like to thank each of you, Dr. John Dowd from the Health Department, the County Health Department, and Dr. Rich Snepar. Thank you so much for being here, your practices in East Brunswick, and then of course, Mayor Brad Cohen for always being available and for all of the excellent work your administration has done and continues to do to help make East Brunswick a healthier place in which to live.
Thanks, Ken.
And
Thank
to
you.
our viewers, thank you so much for tuning in. We hope that we've helped to separate some of the difference between help and hype over this discussion of coronavirus and now the Delta variant. And we hope that it helps you make a more informed decision for yourselves and your family. On behalf of the East Brunswick Advisory Health Council and my panel of experts today, thank you again for tuning in. I'm Dr. Ken Freedman, President of the East Brunswick Advisory Health Council, reminding you that wellness works when you work it.